in here to discuss with you, discuss your chief complaint and what brought you here to the hospital. Is it okay if you can let me know?
Yeah.
All right. Can you tell me your name for me?
Brittany Sinclair.
Thank you. And can I check your wristband? All right. And I've checked her medical record number on my paperwork. Very good. Thank you. And so what brought you here to the hospital today?
Well, I was having a hard time breathing, and I was having a lot of chest pain, so I decided to come in and see what was wrong, I guess.
Okay. When you did come in, you did have, we did take your blood samples, and you were positive for a bacterial infection because your white blood cells were really elevated. And upon examining that, we found out the organism that was causing your fever and that chest pain. Do you have any questions on how that process occurred?
Yeah, so I had an actual infection.
Yes, and this infection actually went to your heart. And what it did was it made your heart valves inside not function as well. So your heart had a hard time beating. And that's where you had such shortness of breath. And you did have peripheral edema on your legs. Your legs were swollen with water, which is why you were fatigued because your body was retaining fluid. So with aortic regurgitation, it usually occurs after an infection, just like exactly what you had, which is the blood is trying to pump, and it keeps getting a backflow occurs because when it pumps, the valve is not working correctly, so the blood falls backward. And when we listen to your lungs, we can hear that whooshing sound. So instead of the normal lub-dub, we hear the lub, but we don't hear the dub. So it's more like a lub whoosh sound. And we confirmed it with the bacteria did cause a little damage to your heart. Your heart does have a little trouble working, which is why you can have like hypertension, trying to beat really hard. We did give you some Lasix to help remove the fluid out of your body and some hypertension medication, as well as some antidysrhythmic drugs. So you will be needing prophylactic antibiotics, maybe for a little bit more longer until the infection is completely gone. Because you've had it, there is a higher risk for you to get it again. So you should stay away, wash it from people that are sick, wash your hands a lot, and yes, you can get it again, but just...
Do I have to change anything for like my eating or like what I do normally? Because I like to run, so can I still run, or do I have to stop that?
Running, it depends on how hard you run. Increased really strong physical activity might make the heart work too hard, and it can't pump as efficiently as before. So maybe try something like do active walking, just walk really fast, maybe more and less intense exercises. And as for diet, stay away from really high sodium foods like processed foods, soups, crackers. If you're going to be eating processed foods, try to choose something on the label that has much more low sodium. So here in the hospital, we did put you on a low sodium diet. And that's pretty much it. You should let your providers know if you're going to get any kind of mouth surgery or invasive surgery, so then they can put you on prophylactic antibiotics prior, so this won't happen again. So that is something very important. And you should be aware of any signs of infection, like a fever again. You did catch it in time. You came here perfect timing and you got rid of this infection. But just be aware of like fever, and if your heart is palpating, and any other shortness of breath that gets really worse, just call us again. Now for your medication, we did prescribe you some Lasix for the excess fluid that your body's carrying right now, and you do have an ACE inhibitor called Vasotec, and a Carvedil, which is for hypertension, and anticoagulant drug called warfarin and an dysrhythmic drug called digoxin. Digoxin is a drug that is really important to know your heart rate. So I will teach you how to take your heart rate. You can check your radial pulse and count the number of beats. Very good. For about a minute. Okay? And it should be above 60. Alright? Before taking digoxin every single day. And warfarin is an anticoagulant, so it makes your blood thinner. So you should be careful to not bruise yourself. When you brush your teeth, use a soft brush so you don't bleed. You can monitor how much blood you're excreting on menstruation because it can make you bleed excessively. If you notice any blood in your stools, that could also be a sign that you're bleeding somewhere in the GI. Just be aware of that, okay? And I have written instructions for you that I've prepared of each medication that you can, and I made multiple copies for you and your husband. So if you have any question, you go ahead and call us, and as well as negative side effects, and we'll take care of you.
Okay, sounds good. Thank you.